While the EFF's march to the offices of the SA Health Products Regulatory Authority has been described as a super spreader event, the march has been criticized as it took place during the third wave of the pandemic, where gatherings have been sharply limited to prevent rising infections. So the party is demanding that SAHPRA speeds up the approval of Russia's Sputnik vaccine and the Chinese Sinovac. So let's discuss this matter further with SAHPRA CEO now, Dr. Boitumelo Semete-Makokotlela. Thank you so much, Dr. Boitumelo, for joining us this evening. I mean, certainly the economic freedom fighters wanted to make a statement regarding their demand for vaccines, and many would say rightfully so, given the times that we're living in. South Africa needs to have vaccines. It needs to vaccinate its people. What is maybe questionable is the timing of it all. What do you say as SAHPRA?
No, thank you. And, you know, we fully understand the pressure that the country is in terms of making sure that we've got access to vaccines. I think SAHPRA staff, equally as the rest of the country, has been affected by this. But the critical thing for us as a regulator in doing our jobs is to ensure that every product that we authorize, we are satisfied that it meets the requirements for safety, quality, and efficacy. And until we're satisfied as a regulator, we are unable to make that regulatory decision. The safety of the public is paramount.
Yeah, I hear you, Dr. Boitumelo, but on the other side of it, when we're looking at, for example, the Sputnik vaccine, I believe that it's been approved in over 60 countries. When we're talking about Sinovac vaccine, it's been approved for emergency use by the World Health Organization as well. And when it comes to this issue of the Sinovac vaccine, if I understand it correctly, China was willing to donate it. I mean, it's donating it to about 53 developing nations. So what's taking so long to make the vaccine safe for South Africa's youth, so that or South African population, so that we can begin the process of procurement?
Yeah, and I mean, you know, we haven't had sight of the type of dossier that has been submitted to those countries. But in terms of the dossier, which is the application that the local applicant has made to SAHPRA, when that was provided to us, we had questions. I mean, we've been, you know, in numerous engagements with both Sinovac and with Sputnik, and they're very clear on what our questions have been. They've responded to some of them. We continue to engage. We got some, you know, sets of data from both of them this week. We're evaluating those, and we will make a decision.
Yeah, but then what are the concerns, though, Dr. Boitumelo? What concerns do you have regarding the Sinovac vaccine as well as the Sputnik vaccines? What are you worried about exactly?
Yeah, and I'm not going to go into detail because some of these matters are confidential with the applicant. But we have to look at the one concern we have is around the efficacy of the vaccines against the variant of concern. In this country, we know the prevalent vaccine is the variant is the beta variant. There is now studies also that are looking into the Delta variant. So we need to ensure that whatever vaccine we authorize has got those. There is also, you know, the Ad5 matter in the Sputnik vaccine, which some of you may be aware in terms of the effects that it had when it was evaluated during an HIV clinical trial. So these are matters that we need to consider and say, you know, are we satisfied that these have been adequately addressed by the applicant?
Well, how long is this going to take, this process of evaluating and ensuring that indeed these vaccines are safe for South Africa's consumption? Because I tell you one thing, the clock is ticking.
Yeah. The clock is ticking indeed, but for us as a regulator, we need to ensure that the applicants provide us with data that is satisfactory. If we don't have data that's satisfied, the minimum, because we've put in place minimum regulatory requirements, we're not asking for the full set. We want minimum regulatory requirements to be met because we understand the emergency of this. We understand that we're in a pandemic, but those minimum requirements must be met before we can make a decision. So it's about the quality of data that we receive. That's what determines the time.
Yeah, and the quality of data means that it could take, what, 6 months, a year, 2 years, 5 years. And I'm saying this so that we can have a realistic perspective of where we stand when it comes to vaccine procurement in this country. Already, we are months behind with our rollout program. Millions of South Africans have been affected. We've just heard now from the Minister or the Acting Minister of Health regarding the Delta variant. So, as I said, once again, the clock is ticking. How long is this going to take?
As I said, the how long we take is all about how quickly the applicants give us data that satisfies us.
Yeah.
And if the data is not satisfactory, we will ask for data that meets the minimum requirements. We cannot authorize a vaccine that we have questions about its safety or its efficacy. And I'm not saying that, we're saying these are questionable vaccines. We're saying the applicants need to make sure that we've got data that satisfies us as a regulatory authority.
Let's talk a little bit about the AstraZeneca vaccine now. From what we understand, and studies have shown, is that the AstraZeneca vaccine seems to be effective against the Delta variant. And it's the Delta variant that we are now facing in South Africa. We know that it was quite prevalent in India. Does that mean that we're going to have to look at reprocuring the AstraZeneca vaccine to tackle what we're dealing with right now, which is the spread of the Delta variant in the country?
Yeah, so we can't get involved in matters of procurement. What we would need to do, the authorization that we had given to AstraZeneca was for a limited number of doses for a limited period. So they would then need to come back and apply for that extension with us. But whether the state procures from them or not, we cannot determine what will happen there.
And of course, I mean, we're looking at the future now when it comes to looking at the vaccines and how they're going to be looking at where are we sitting? I mean, which vaccines are at this moment approved for use for South Africa that you're confident are going to help South Africans, and which ones are on the pipeline to be added already into the current vaccination program as per what SAHPRA is recommending?
Sure. So you're all aware we've authorized Pfizer under Section 21. The Janssen J&J vaccine has got conditional market authorization. And I must say, none of the vaccines have got full authorization across the world. So all of them are either emergency use or conditional authorization. We're currently evaluating Sinovac, Sputnik, and we last week received an application, the week that we're just coming out from, we received an application from Sinopharm. So we've got 3 sets of volumes of data that we evaluate as a regulator.
And those vaccines you are comfortable for safety use for South Africans. Meanwhile, the Sputnik, maybe the Cuban vaccine, and also the Sinovac vaccine is not as yet at a level of comfortability for the use for South Africans.
So we haven't received any application from Cuba yet. We have not received any application from any other vaccine that has emergency use listing by the WHO, like Moderna, etc. So we evaluate what has been submitted to us. And us as a regulator, we cannot go out and solicit applications because we're a neutral organization and we cannot be engaging with industry like that. So until we receive an application from Cuba, there will not be a vaccine from Cuba available in the country.
We'll leave it there. Dr. Boitumelo Semete-Makokotlela, who's the SAHPRA CEO, giving us the latest on that vaccine matter.